All right, so let's get started. First up is House File 4735, which is the Supplemental Early Childhood Omnibus Bill. This is a bill that spans two committees, Education and Human Services. Even though we'll be splitting House File 4725 between the two omnibus bill, Chair Pinto, I understand you'd like to present the entire package today. So hopefully we want to do this again when Health and Human Service come here. I think that's how we did it last year. So let's move the bill and begin. Chair Pinto.
Thank you, Madam Chair. So I do move House File 4735 to bring it before the committee. And I'll proceed with your permission.
Okay, would you also like to move the H 4735 A6 amendment?
Madam Chair, I think what I may do, if it's okay, is to describe the bill first for a bit, and then we can get to the amendment. I think that might make more sense.
Please proceed.
Thank you, Madam Chair. Members, so I'm really delighted to be with you today to present the supplemental budget proposal from the Early Childhood Committee. As the Chair said, our proposal does span, as it has for the last few years, both the E12 Committee's jurisdiction or that area, and HHS as well. So we'll be moving the education portion later today and the HHS portion in a week, but discussing the whole proposal today. Adding to the confusion is that there's a portion of the E12 budget proposal that actually came out of our committee as well relating to pre-K. And so my hope is that we're able to discuss that as well as part of this. Members, childcare and early learning was in deep crisis even before the pandemic. And then the pandemic, of course, made the situation even worse. This is a sector where families are paying a huge portion of their income for care, where providers are living off poverty wages, and where young kids are not receiving the great start that they deserve. It's probably important to note at the very start that the issue is that the economics simply don't add up. And so the challenge is that we want to make sure that we are providing the support that young kids need and that families need. So members, and a reminder that this is foundational to our economy and to our society. This is about our workforce now in the form of parents working and employers being able to grow and communities to thrive. And it's also our workforce of the future to give kids the great start that they deserve and to avoid the opportunity gaps that we see in school and beyond, and that I will note that start well before school. And so for closing opportunity gaps, this is the place to do it. During the pandemic, members, we saw that public investment worked. We were one of the very first states, maybe even the first state, to provide state support to our child care providers, and we had a much more stabilized sector than in other states. If you ask any parent of young kids, any kindergarten teacher, any employer, that child care is, for those employers, child care is one of the top workforce development concerns for companies and communities throughout the state. So all that is lead up to say that the bill in front of you today goes right at those needs that that I described. So first, we invest in the kids and families with the very biggest payoff. The Child Care Assistance Program helps low-income families. And what we do is we increase rates to the federal guideline for equal access. That's the 75th percentile. This is the rate at which we've determined that families, and the federal government has determined that families can actually afford care and to have their kids taken care of and have them be able to work so they can pay for rent and for food, et cetera. We expand eligibility for the program to include foster parents and guardians, which is, of course, really important because those are kids we're especially concerned about. And we reduce waiting lists. We also provide early learning scholarships to 20,000 young kids birth to 3, infants and toddlers from low income and vulnerable families. These, again, are the kids that we're most concerned about. And then as these kids turn 4, we ensure that they have access to a voluntary pre-K that can be at their public school, at their Head Start, at their child care provider. It's mixed delivery, it's voluntary. We want to make sure that those kids have that connection to school. And we'll be able to talk more about that in detail, I'm sure. So we focus on those kids and families with the very biggest payoff, but we also provide great support for those providing this critical service. There's funding for training, for workforce development, and I guess I'll point you to, in a way, that the spreadsheet that we have has a really nice list of the programs and the approaches that we take. wanting to make sure that we are providing, there's a one-stop child care assistance network that you'll see that was called for by our critical family child care providers. We have something called the Brain Builders program to help those who are working with infants and toddlers to maintain their connection, because we know that ongoing relationship is so critical for brain development for the youngest kids. And perhaps most important relates to the stabilization grants that I mentioned at the very start of the pandemic. Our state was the first to start these grants. They've been going out monthly to providers ever since, with state funding, with federal funding. Members, we may not have noticed this issue so much recently because, in fact, our sector has not collapsed because of that support that's been provided. Those stabilization grants are tailing off, and what our budget does is to make sure that those grants stay in place through the remainder of the biennium and are going at a lower level from there on out. Members, this is a public good. I cannot think of a more powerful public good than getting our young kids off to a great start and having it be at the same time that we're supporting their families to work, et cetera. And what we do is that we have our public support should in fact reflect that public good. Madam Chair, I may at this point ask to have to advance the amendment then, with your permission.
Yes, please.
Okay. So members, the A6 contains largely technical changes. There's one particular item that I'm going to highlight, but largely technical changes. I'll note that I had mentioned that Brain Builders program. We make a shift in that program. It looks like it's a brand new program. It's actually not. What we're doing is actually converting into a pilot program. It's a less, essentially a lesser approach than we were taking in the original bill. We want to make sure that we have time to make sure that we're clear on that. A few other things as well, but the big thing I wanted to note is there's a proposal for IT infrastructure to address concerns that have been identified for several years now regarding how the different data systems are talking to one another and how different data sharing works across the different agencies. And so we do make some changes to that, in particular in response to a fiscal note that was just recently received to make sure the different agencies have the costs that they need covered for that. And I'm certainly happy to talk more about that. But members, I would ask that you pass the A6 and we can talk further about the bill.
Thank you, Chair Pinto. Are there any questions on the amendment? Representative Garofalo.
Thank you, Madam Chair, and this would be a question for our fiscal staff. So we have two spreadsheets in our packet. One of them is labeled the A5 amendment as referred to Ways and Means. The other one is the A6 amendment that Representative Pinto is offering. I just want to make sure that's the only difference between, I didn't review this spreadsheet yet. Is that the only difference is the Pinto amendment between these two spreadsheets?
Okay, Ms. Adrian.
Madam Chair and Representative Garofalo and members, I believe that is correct. Ms. Beckel is on the meeting. I don't know if she wants to make any additional mention of it, but that is my understanding that that's the only difference.
Thank you. That's good. Thank you.
All right. Are there any other questions to Representative Scott?
Thank you, Madam Chair. And I'm wondering if the bill's author could just address lines 6.13 through 6.17 and explain to the committee the data sharing components of that paragraph. Of the amendment, Madam Chair.
Representative Pinto.
Thank you, Madam Chair. Thank you, Representative Scott, so much for highlighting that. So let me think. I may need to take just a second to step back if folks don't mind. There was there have been concerns about governance in early childhood for a number of years, recognizing that we have a whole bunch of different programs across multiple agencies and a lot of complexity. We, as a legislature, directed the administration last year to put together a governance report to say, how's this working? How can it work better? And one of the findings from that report was saying that there's a real challenge with data sharing and with different programs working together. I mean, literally, that subsidies for early care and learning are contained in Department of Human Services in the form of CCAP, in MDE in the form of early learning scholarships, school readiness plus, voluntary pre-K Pathway 1 scholarships, Pathway 2 scholarships. It's a lot going on. And they said that there's a need for that to be looked at. And there was a 2018 Office of Legislative Auditor report saying as well a real challenge with this. So these lines that you pointed out, Representative Scott, come out of a bill that I had that moved through the Early Childhood Committee, was heard in State Gov Finance, and passed back to Early Childhood. That would address both concerns about the technology and then the different computer systems being able to talk to each other. They're super old, as I gather, and a big mess. But then also looking at any sort of administrative rules or challenges that maybe need to be changed. Of course, anything that would need to happen legislatively, they need to come back to us for us to report on. But this comes out of that, and then there's a series. I think you've pointed out these lines, but they're connected to other lines throughout the amendment as well of funding to get that done. So that at least maybe gives you a big picture. You may have a more detailed question, but hopefully gives you the context.
Representative Scott.
Thank you, Madam Chair. And so is this, was this heard in education policy?
Chair Pinto.
Madam Chair?
Thank you, Madam Chair. It was not in our education policy because this is within the early childhood jurisdiction.
Okay.
So yeah, no.
Okay,
Representative Scott.
thank you, Madam Chair. And did this go to judiciary and civil law since this deals with data sharing?
Chair Pinto.
Thank you, Madam Chair. We checked with Chair Becker-Finn, as I recall, and there was not a need for it to be seen. It's not proposing any changes to any of our statutes. What it really is having the different agencies look at how they interact with one another. This is all data that's already held by the agencies and by state agencies, and looking at how they communicate with one another. Representative Scott.
Representative Scott.
Thank you, Madam Chair. Thank you, Representative Pinto. So this is more on a tech level, just sort of interconnecting the databases, if you will, or and if you know, what information is being shared?
Chair Pinto.
Thank you, Madam Chair. And I wonder, maybe staff, Ms. Ma, can just help remind me, because I'm just struggling with it, about where in the bill, because we can direct Representative Scott to the language this is referred, the underlying language of the bill. I think that'd be helpful for you, Representative Scott.
Mock. Mr. Mock.
Ms. Mock.
Thank you, Madam Chair.
Okay.
So the language that this is referring to is in House File 4735, the first engrossment, in Article 3, Section 4. And what the direction to the Commissioner of Management and Budget is to identify any state or federal statutes or administrative rules and practices that prevent or complicate data sharing among early childhood programs.
Representative Scott.
Madam Chair, thank you. Could the testifier please give us a page and line number in the underlying bill? Because
Ms. Mock.
Thank you, Madam Chair. So it starts on page 27, line 28.
There we go.
Madam Chair, if somebody else has questions, you can go to them while I look at this in more detail. If that's okay.
While we're waiting for you to read up on that, Ms. Adrian has a clarifying statement in regards to Representative Garofalo's question about the spreadsheet.
Thank you, Madam Chair, members. I haven't had nearly enough coffee yet this morning, so I just wanted to correct what I was saying. So for the early childhood spreadsheet, there should only be one document, and that one is, it was amended by the A6. And when we get to the education portion, there are two tracking documents also amended by the A6. And so the difference there, the distinction is one reflects one of the amendments and one was as referred to Ways and Means. But for this bill that we're talking about, there should only be one spreadsheet.
Yep.
Sorry about that.
No, that's what you said.
Okay.
Thank you.
Representative Scott.
Thanks, Madam Chair. And Representative Pinto and whoever was on the testifier online. So are the parents, do they sign off on this data sharing? Is this data sharing that's already done? If the author knows.
Chair Pinto.
Thank you, Madam Chair. Representative Scott, yes, they, well, I definitely know the second half of your question, which is this is data sharing that is already done, that it's not, this is simply talking about data that's already in the hands of these programs. I would assume, well, I guess I should probably stop there because I'm not an expert at how, all I know is that there's a whole lot of different programs and it's a very fragmented space, but this is not talking about expanding data collection in any way. This is information that's already in the hands of the agencies. Yeah, that's correct.
Representative Scott.
Thank you, Madam Chair. So if, I'm just concerned that if they're sharing the data from one, like, quote-unquote agency to another agency, that the parents have signed off on that. So I guess, Madam Chair, maybe I'll just talk with the bill's author offline to just have some assurances on that. Just want to make sure that the parents are given that ability. So thank you, Madam Chair.
Yes, thank you. Are there any other questions on the amendment? So seeing no further question, the A6 amendment is before us. All in favor say aye.
Aye.
All opposed say nay. The motion prevails and the amendment is adopted. Okay, Chair Pinto, you want to continue with your presentation as amended?
Thank you so much, Madam Chair. And I want to make sure before I forget, just to thank Representative Scott. Yeah, I'd be really happy to talk with her and take advantage of her expertise. So be happy to do that. And then I think there's plenty of good stuff in here, but I'm thinking what I'll do is turn to questions,
Yeah.
Madam Chair.
And there's no other amendment with pre-filed, so we're going to open up for questions on the bill as amended. Any questions? Representative Kresha.
Thank you, Madam Chair, and thank you, Chair Pinto, for your bill. So just a couple of questions as I go through this. Well, can I do that, Madam Chair? Can I have staff explain the changes to the Pathway 1, Pathway 2 funding mechanisms? And
Yes,
what
you
those
may.
dollar changes would be?
Yeah, can staff, look at that.
Maybe Ms. Mock, probably.
Ms. Mock, is that a question for you also?
Madam Chair, I think that would be a better question for Ms. Beckel.
Ms. Speckler? Ms. Beckler.
Thank you, Madam Chair.
Okay.
I'm just trying to hear. It's a little bit difficult. Please
Thank you,
testify.
Madam
Can you
Chair.
speak to this?
Thank you, Madam
Introduce
Chair.
yourself for the committee and proceed.
Solveig Beckel, House Fiscal. Yes, so part of the VPK proposal is to reallocate funding that is currently going towards Pathway 2, the Pathway 2 program, toward the mixed delivery voluntary pre-K programs. And so the funding in this bill, if you'll allow me one moment, because the voluntary pre-kindergarten program was related to so many formula changes, the VPK proposal was carried in its entirety in the education, the K through 12 omnibus. But to answer your question, there will be roughly 18 million in fiscal year 23 that is to be reallocated under this program from Pathway 2 to the mixed delivery voluntary pre-kindergarten program. I can talk more to that now if you'd like, or when we discuss the education omnibus.
Representative Kresha, were you able to hear and understand the difference in the pathways?
Madam Chair, we're in the Capitol. I'll just make up the narrative as I need to be. Thank you. I did hear it, so
Proceed.
thank you. So first question on that. If I heard that correct, Chair Pinto, one of the net effects will be $18 million will be moved out of Pathway 2 into the mixed delivery. Is that correct?
Oh, Chair Pinto.
Thank you, Madam Chair. Representative Kresha, yeah, that's what I heard as well. And I maybe just to add that my understanding is that the plan, I believe what what I intended to do anyway, is to basically no longer have Pathway 2 scholarships, which for those not as familiar, they're the ones that go to a provider as opposed to going necessarily with an individual family. And the Pathway 1 scholarships then would be aimed at infants and toddlers. And instead for pre-K, it'd be that mixed delivery system and no more Pathway 2 scholarships.
Representative Kresha.
Thank you. And so, Mr. Chair, that begs the question, we're now moving and we're shifting the dollars to the mixed delivery in the 0 to 3. What happens to the 4 through 5-year-olds?
Chair Pinto.
Thank you, Madam Chair. Thank you, Representative Kresha. Well, the 18 million actually doesn't get shifted to infants and toddlers. It gets shifted to the 4-year-old VPK program. So for kids who are 4 and older, they are part of the mixed delivery VPK program. So they'll go to their local licensed child care provider or Head Start or public school. It's the Pathway 1 scholarships then that aim at the infants and toddlers. I hope that's answering what you're asking.
Representative Kresha.
Madam Chair, so what you're telling me is so we're actually covering all of our bases, even though we're shifting to the 0 and 3. We have enough now that won't create a donut hole of students that won't be, or children that won't be serviced by any of these models. Is that correct?
Chair Pinto.
Thank you, Madam Chair. And Representative Kresha, correct, no donut hole. More kids need care, but as far as those lowest income kids, yep, they're covered from birth on up through these different methods, correct.
Representative Kresha.
Thank you, Madam Chair. And do you have the success metrics on Pathway 1 versus Pathway 2 and why we would do those shifts?
Chair Pinto.
Thank you, Madam Chair. I don't know that I do with me. I guess I've thought of you, Representative Kresha, as being somebody who's a real fan of Pathway 1 scholarships, which makes me think you'd be very happy with the major increase in Pathway 1 scholarships here. But I don't have those metrics with me. I just know that when you invest in young kids in all these different ways, huge payoffs.
Representative Kresha.
Thank you, Madam Chair. And my happiness is not on the stand today, it's the bill. And so thank you, Chair Pinto. I just want to make sure I understand it and make sure that we're covering across the board. So when we look at that, and yes, you've left the Pathway 1 largely untouched, of course, which goes right to the families and the kids. And I just want to make sure that even, I think there's a tendency from some to go to a mixed delivery or more institutional model, which would move us away from some of the things that have worked, especially in some of the neighborhoods and communities across the country that can use the choice. So my next question is, we make a large push in here for CCAP. Do we have any metrics? Do we have any outcomes on how CCAP performs versus Pathway 1 funding?
Chair Pinto.
And was that a part of the consideration?
Thank you, Madam Chair. So what I'll say, Representative Kresha, is different programs for different needs, and we know that in Greater Minnesota, especially, that CCAP plays just a critical role in keeping those communities and keeping communities going, keeping employers being able to have workers, et cetera. I don't have data with me specifically about one program versus another, but I do know that there's again just a tremendous payoff in each one of these approaches.
Really quick, I just want to remind members there's a little buzzing or something that's happening to remove your phones away from the microphone. Thank you. Remove your phones from the microphones. Did you hear it? Okay. Representative Kresha.
Thank you, Madam Chair. So understand your comments, Chair Pinto. I would submit, though, that what we're doing here is we're putting the needs of an institution ahead of the needs of the kids. And what I heard in your comments, I don't want to take them in a different direction that you intended, but what I'm sensing is we're putting dollars in to keep programs running versus putting dollars into what can be the most effective for our kids. I don't think that just simply enrollment is a metric. In fact, I think the metrics we should be looking at is kindergarten readiness and how those outcomes come to the achievement gaps later and learning losses that can happen. I respect where you're going with here. I disagree that by simply putting more dollars into a program to expand the net without considerations of how that's going to drive outcomes isn't a good way to put together a bill. Can MDE repurpose any of the funds that we put together at their discretion?
Chair Pinto.
Thank you, Madam Chair. Representative Kresha, I don't believe so, but that may be something that we should have staff, if there's anybody who can, certainly my intent was that I think anybody that I've dealt with in the administration otherwise knows that I want every single dollar to go to young kids and their care and learning. But if there may be assistance that staff can provide if there's something that I'm missing there.
And Representative Chair Pinto, maybe you can get closer to your mic.
Okay. Oh, thank you.
Yeah.
I've been backing off, I think, because of the echo I've been hearing, but
Yeah.
I'll get closer myself.
Yeah. Representative Kresha, do you need more information?
Well, I'd like an answer.
Pardon me?
I'd like an answer.
Is there staff, is there someone that can respond? We have MDE on a call. Can you please respond to the question? Introduce yourself.
Madam Chair, Solveig Beckel, House Fiscal. Can you hear me any better?
It's really a little difficult.
She needs to get closer.
Okay, I will try to
That's
speak
better.
loudly.
Yes,
That's better?
That's better.
Okay. I'm not entirely sure I'm understanding the question fully, but I did want to add that in the VPK program, which again is fully in the education omnibus, there are allowances for MDE in terms of administration. So roughly 2.4 million per year is allocated to administration for distributing the mixed delivery funds, so to Head Start and to family and licensed centers. And then there's an additional roughly 2.5 million that MDE is allowed to use for administering the entire program. I see Mr. Unni from the department is here, so he can correct me if that is incorrect.
Madam Chair, maybe I can clarify my question.
okay, Representative Kresha.
Let me ask it this way, and Chair Pinto, perhaps you can point me. What in this bill prevents MDE from reallocating any of the money from one program or a grant to something that someone chooses they'd like to do differently?
Chair Pinto.
Yeah, sure. Thank you, Madam Chair. So Representative Kresha, I guess, so I should note, it is my intention, absolutely, the funds go to the areas that we direct them to go, and it'd be my expectation, I mean, when the legislature says you shall spend X on Y, that X is spent on Y and is not spent on Z. Or going back around A, B, or C. So it's written that way, that's absolutely the intention. So I think if the department were to do such a thing, unless you think I'm misreading something, and please point it out, or anybody else who's listening, but my thinking is if we tell them to spend X on Y, and they spend it on Z, that's a problem. I mean, they have now not done what we told them to do. And I think we all, I mean, I'll be the first one to go after them hard. I don't know what else to say.
Okay, thank you, Madam Chair. And I'm not really, I just wanted to make sure that was in there. I'm looking for the safeguard.
Right.
I mean, I think that your passion and your experience and what you've done in early childhood begs that you're looking for the best results. And I just want to make sure that those intentions, if this is passed, are carried through and not changed because somebody changes their mind at the executive level, which we've seen in the past.
Me neither.
In other areas. Madam Chair?
Representative Kresha.
So just a couple more questions. Chair Pinto, in Article 5, you make the change of the distribution of the appropriation where in lines 2.297 and 298, that migrant and Indian reservation programs were initially allocated, and we now put a 10.72% appropriation. Why the change? What wasn't happening that needed to happen?
Chair Pinto.
Thank you, Madam Chair. And I may need to, that was a proposal originally from the administration, and I may need to ask either Ms. Mock to help remind me about that. I think she's done this a couple times now, it just keeps slipping out of my head, or potentially MD, but maybe we'll see what Ms. Mock thinks of House Research, Madam Chair.
Ms. Mock.
Thank you, Madam Chair. I will actually ask Mr. Unni from MDE to take that question.
Okay. Mr. Unni.
Madam Chair, committee members, my name is Adosh Unni. I'm the Director of Government Relations for the Minnesota Department of Education. And this has been a proposal that we've come with for several years now to maintain the stability of funding for tribal Head Start programs. This has been something that's been discussed amongst Head Start programs in general as a proposal that they can all get behind. And this will help maintain the stability of programs that serve some of our most underserved youngest learners in the state.
Okay.
Madam Chair.
Representative Kresha.
Thank you. And hello, Mr. Unni, how are you? So this is a proposal that's come a couple of times. Why 10.72%? What is the magic number about that with stability versus how we were doing this before? Can you just walk me through the gap?
Mr. Unni.
Madam Chair, Representative Kresha, at this point, I think I have my Assistant Commissioner Bobby Burnham on, who's got a deeper history with this proposal, so I'll defer to her.
Ms. Burney.
Thank you, Madam Chair. That is a really good question, Representative Kresha. So what typically happens from year to year, because our state, these are Head Start tribal programs. So because the state Head Start funds are based off the federal formula, and the federal formula fluctuates from year to year, we were finding that the tribal Head Start programs fluctuated greatly from year to year with over the last couple of years, mainly decreases in funding. So this 10.72% really is an effort to hold them harmless. And I believe the 2018 funding allocation, and to give them a predetermined amount every year that they can depend on to do their programming and services to children. So this is really around taking away the fluctuation with those tribal Head Start programs due to the federal funding formula. I think over the past years, we've had at least 1 or 2 new federally funded Head Start programs, which then we have to go through a different formula for the state. So when there's more programs, other programs get less money because that 25 million in state funds is a set amount. So it's really balancing all the numbers and ensuring that those tribal Head Start programs have a predetermined amount to provide their services.
Representative Kresha.
Thank you, Madam Chair. Okay, so, and I appreciate that. I understand the goal of having stabilized funding. So, and I'm sorry, the testifier, I caught her first name. Was it Berman? Miss Berman, was that? I want to pronounce that correctly.
Yes.
So, Miss Berman, just so I understand, so what you're saying is when there's funding and then we at the legislature or the executive branch grows more programs, there's less money, so therefore the dollar amounts go down. Is that correct?
Ms. Burnham.
Thank you, Madam Chair. That is correct. So because the state Head Start programs are federally administered, we at the state have that $25 million allocation, which is great. Not very many states do that. So we allocate that state money in the same manner that the feds allocate their federal allocations. So it allows for too much fluctuation for those tribal Head Start programs.
Representative Kresha.
Thank you, Madam Chair, and thank you, Ms. Berman. So thank you, Chair Pinto, for putting this in, and I think we've put another finger in the dike, but we haven't actually fixed the water level, which is we're creating more programs, which are therefore lowering the water for everybody. And I understand what we're doing now, which is we are truly holding them harmless. We're taking one segment of the Head Start and we're segmenting them off so that they cannot be affected when legislators or the legislature pass or creates more programs. So I see why you're doing that, and I see why there's multiple proposals. I also see that every organization out there would like to have a carve out like this. So, but again, I don't dispute where you're going, the effects of it. I dispute the fact that it's us that are creating the problems by creating more programs. The last one that I have is, I'm curious, Chair Pinto, we put $125,000 in the ombudsperson for the family child care providers. Ombuds person positions, we see them pop up all the time. What I really want to know, and maybe you can help me through this, I mean, it seems to be a nice bone that we throw at people, but what is it really going to solve? What will that $125,000, what metric or what outcome will we actually see that will be improved by having that position?
Chair Pinto.
Thank you, Madam Chair. Thanks, Representative Kresha, for the question. So that position, Family Child Care Ombudsperson, came out as a recommendation, a request from the Family Child Care Task Force that we appointed as a legislature, and I'm trying to think of the exact time. It would have been a couple years ago now, and they had a series of recommendations. I should note that not only did our budget last year include a whole bunch of recommendations, this budget includes other ones as well. You'll notice shared services to allow family child care providers to efficiently share kind of back-end services to help save some money that way, and the one-stop shop I think I mentioned earlier. But this was another one of those, and to make sure that those that request was met. As I gather, they wanted to have a person who was going to be in the position of bringing concerns forward and being in contact with family child care providers around the state, who are, of course, in a really, really challenging position and in what is a very challenging sector, as I said before.
Representative Kresha.
Thank you, Madam Chair. And Chair Pinto, thank you for that. And I mean, I understand the spirit of which this was created. I'm just, my concern is what we've created is one more person to take notes and admire the problems that we already have. I mean, when we look at Health and Human Services, and there's some, I've worked with many people in the Health and Human Services, whether it's child protection, family child care providers, early child, and they're all seeing the problems. They're gathering this. We travel around the state. I just, it's 125,000, but again, we just heard that the more we expand things, the less money is available for the programs. We have to create carve-outs, and my contention here is, okay, it's a nice to have, but isn't this just the 75th redundancy and the 75th amplification of what we've already heard about the challenges in family child care providers? So, but it's your bill. And I understand, that why you might put that in. So thank you, Chair Pinto. Thank you. I wish you the best of luck with the bill going forward. No further questions.
Thank you, Representative Kresha. Representative O'Neill.
Thank you, Madam Chair. Good to see you, Representative Pinto. I just have a few quick questions about CCAP. And you and I serve on public safety, and we worked on some really tough things in the past. And my question is, it looks like you're putting an awful lot of money. It looks like $220 million and some change into CCAP, which, I'm sure it's needed, but my concern is when the OLA did a deep dive into the CCAP program, we found a great deal of fraud, waste, and abuse, heavy on the fraud. And I'm wondering what's been done since the OLA report to the CCAP program to tighten that up, and if you could speak to that. And the other thing I was wondering is, as I'm looking through, it looks like we're going from, for infants and toddlers, from the 40th percentile all the way up to 75th percentile. And for preschoolers, school-aged, it's closer to the 30th percentile up to the 75th percentile, which is obviously equates to the $220 million that we're adding into the program. So can you just further explain the thought process behind that huge move? It's almost a doubling. And then what kind of provisions either are in this bill or have been done to deal with waste, fraud, and abuse?
Chair Pinto.
Thank you, Madam Chair, and thank you so much, Representative O'Neill, for bringing that up. So one challenge is that nobody else on Ways and Means serves on early childhood, so you wouldn't have had the chance to hear about all this. So in 2019, we enacted as a legislature a series of significant reforms in the program, and I'm looking, and I can maybe get to you afterwards, Representative O'Neill, kind of a summary sheet from past years, but enhancing record-keeping requirements for CCAP providers, clarifying various requirements, having a uniform method for calculating attendance record overpayments. I got a long list, and in particular, directing that there be, and I think part of this was on a DHS initiative as well, that there be a continuous improvement group that went in and just went stem to stern on the whole program. So our very first hearing in 2020 then in the Early Childhood Committee was a report on this. This is a couple years ago now. And I would urge folks to watch the hearing, because as a member, to a member from DFL, GOP, et cetera, I think it's fair to say folks were extremely impressed. And this was a couple of years ago. So to answer your question, what has been done? A massive amount has been done. And the program is in a very different place. I would challenge some of the points about where things were even in the past. But regardless, we had massive changes. Now, if everybody did everything perfectly all the time, then as a prosecutor, I'd be out of a job. right? So we know that there's, things are not perfect, but we want to make sure is that we are preventing to the extent we can, and then to the extent folks are doing things that are wrong, that we're holding them accountable. And there's a lot in place on that. So feeling very good about that piece of things. And then regarding the rates, and I should have said this before, Minnesota is in, I think, like the bottom 5 in the country in terms of the rates for our child care assistance program. It's got a different name in different states. Some of the states that are 75th percentile include both of the Dakotas, Kansas, Kentucky, Utah, Alabama, Arkansas, 75th percentile. Minnesota's in the bottom 5. And so no wonder we're having huge challenges throughout our state. So we should feel very good about the idea that our state should be at the level of those other states and a level where people will actually be able to pay for care so they can work, which is they're trying to do so they can pay the rent and pay for diapers for their kids. Thanks.
Yes, Representative O'Neill.
Thank you. Thank you, Madam Chair. Thank you, Representative Pinto. I appreciate that, and I think the proof's in the pudding, so we'll have to, hopefully there is ongoing follow-up to make sure that everything is as we hope it is, as you had said, and I know that you see the underbelly, so to speak, of society as a prosecutor in your daily work. It's interesting. So if the 75th percentile, that brings us to where nationally?
Chair Pinto.
Then we'll be at the standard for making sure that families have that costs are appropriately covered. So that's I guess notes that I have say that these it's 17 states where all their rates are the 75th percentile. Another 5 states have some of their rates to the 75th percentile. And our state has a difference between preschoolers versus the younger kids. The notes I have say 75th and higher, so I suppose maybe there are states that are higher than 75th, but 75th is the standard. I would expect that that's where we want to get to.
Mm-hmm. Representative O'Neill.
Thank you, Madam Chair. Thank you, Representative Pinto. I'd like to work with you a little bit more. I know I have this vague recollection. I think it might have been you bringing me the bill, and we were discussing about some of the fraud, waste, and abuse, and trying to tightening up. And I don't know, it was one of those hallway conversations I think we may have had. So I know that there was a movement in that direction. It'd be really interesting to see if the OLA will circle back and reevaluate the CCAP program, because I can tell you Minnesotans are incredibly concerned about the waste, fraud, and abuse. And nobody really knows the number because it was really too difficult to even calculate according to the OLA, but it was large. It wasn't a couple million. So I think Minnesotans are incredibly concerned about the CCAP program. If we're going to literally double and put $220 million more into it, that it's safe and secure and the money goes to where it's been intended. So I just want to make sure that we get that on the record. And again, I really hope the proof's in the pudding that we've tightened up those massive holes that were there in the past.
Chair Pinto.
Thank you, Madam Chair. And I'll just note, Representative O'Neill, so we have had a hearing every year that I've been chair. We've had a hearing with a report on the follow-up from this towards the beginning of each session. So we did again this year. That OLA report was now 4 years ago. And again, a lot has changed in part because of the work that we've all done. So, and it's ongoing, of course, as well. Thanks.
Thank you.
Thank you. Well, seeing no further discussion, Chair Pinto, do you have any closing comments?
I do, Madam Chair, just briefly. First, I wanted not to forget to thank not only the staff, and you've gotten to hear some of them, especially Ms. Mock and Ms. Beckel, and Mr. Berg we didn't hear from today, but have been incredible. But also Lead Franson, who is not on Ways and Means, but has been a very good partner to me in this work, and so I've been grateful to her for the partnership, and to our members on the committee as well. I did want to highlight something, members, that I had not said at the beginning, but feels important to note. Representative Kresha had asked some questions about the pre-K program, and Chair Dabney will be coming up. But I wanted us just to recognize that it really is, although it's mixed delivery, there's a couple different places that kids can go. It is a comprehensive program, a comprehensive approach to say that whether a kid is in their licensed child care provider or their public school or at their Head Start, that we have a series of standards and measurement of progress and quality in terms of teaching and a connection with schools. That's something that I had not highlighted earlier and feels really well worth connecting and highlighting, that this is, we're really trying to make sure the kids at birth all the way up get off to a great start. I'm so grateful for the conversation, and I know it'll continue. Thank you, Madam Chair and members.
Well, I just want to thank you, Chair Pinto, and your committee for your excellent work on behalf of our earliest learner. We've come a long way from 2019, 2018, when when we first heard of the abuse that was happening, especially around the CCAP, you put a lot of protections in place to make sure that we are doing our due diligence as a state to make sure that our early learners are getting off to a great start, that they are entering kindergarten ready and prepared, and that we are creating a path of success by the time they're in third grade, because that's the indicator of what will happen to our youngest learners and our students. So I always want to say thank you for that work. What an awesome job. And with that, I would temporarily lay over House File 4735 as amended. Thank you.